Dear teacher trainee, we will in this unit learn about the different causes of blindness and low vision. The many causes of blindness differ according to the socio-economic condition of a nation. In developed nations, the leading causes of blindness include ocular complications of diabetes, macular degeneration, and traumatic injuries. In third world nations, where blindness is much more common and where about 85% of the world's blindness occurs. Principal causes include infections, cataracts, glaucoma, injury, and inability to obtain any glasses. Infectious causes in underdeveloped areas of the world include trachoma, onchocerciasis or river blindness, and leprosy. The most common infectious cause of blindness in developed nations is herpes simplex. In spite of the progress made in the surgical techniques in many countries during the last 10 years, cataract 47.9% remains the leading cause of visual impairment in all areas of the world, except for developed countries. The blind population in India is estimated to rise to 15 million by the year 2020. Cataract is the leading cause of blindness in India, while refraction error and glaucoma are the second and third leading causes of blindness respectively in India. In India, since trachoma is limited, onchocerciasis is non-existent, glaucoma, diabetic retinopathy and corneal diseases form priorities under India's Vision 2020 action plan. Some of the common causes of visual impairment are parental causes before birth, history of visual impairment in the family, consanguineous marriages, marriages between close relatives, blood group complications or Rh incompatibility between the parents, infectious diseases or illness contracted by the mother during pregnancy, especially syphilis or German measles, rubella, particularly during the first 3 months of pregnancy, poor health of the pregnant mother, intake of antibiotics or any other drugs by the mother which are not prescribed by a doctor, exposure to X-rays during pregnancy, malnutrition, particularly vitamin A deficiency, perinatal causes during birth, premature delivery, low birth weight of the baby, birth weight less than 2.5 kilos, lack of oxygen to the infant during delivery, delivery using instruments such as forceps wrongly may cause damage to parts of the brain responsible for seeing. Postnatal causes after birth, infectious diseases, example measles, syphilis, rubella, viral fever contracted by the child during childhood, injury to the eye such as a sharp object entering the eye or a head injury, tumors in the eye, neglect of infection of the eye, vitamin A deficiency. Thus, we see that both hereditary as indicated by history of visual impairment in the family and environmental factors, example infectious diseases or injury, can lead to visual impairment. Many of the environmental causes of visual impairment are preventable. Proper care of the mother during pregnancy, the presence of trained staff during delivery, adequate nutrition of the mother and the child, especially intake of food rich in vitamin A during childhood, immunizing the child against preventable diseases and other such precautionary measures can help in the prevention of visual impairment. Many of the causes of visual impairment are preventable. Let us now learn what is a cataract. A cataract is an eye disease in which the clear lens of the eye becomes cloudy, opaque, causing decrease in vision. Although the word cataract to describe this condition has been part of the English language only since the middle of the 16th century. The eye disease has been recognized and surgically treated since ancient times. The lens is a portion of the eye that is normally clear. It assists in focusing rays of light entering the eye into the retina, the light sensitive tissue at the back of the eye. In order to get a clear image onto the retina, the portions of the eye in front of the retina, including the lens, must be clear and transparent. Once light reaches the retina, the light initiates a chemical reaction within the retina. The chemical reaction in turn initiates an electrical response which is carried to the brain through the optic nerve. The brain then interprets what the eye sees. In a normal eye, light passes through the transparent lens to the retina. The lens must be clear for the retina to receive a sharp image. If the lens is cloudy from a cataract, the image striking the retina will be blurry and the vision will be blurry. The extent of the visual disturbance is dependent upon the degree of cloudiness of the lens. Cataracts are very common in older people. By age 80, more than half of all Americans either have some degree of cataract or have already undergone cataract surgery in one or both eyes. By age 95, this percentage increases to almost 100%. A cataract is not contagious and cannot spread from one eye to the other or from one person to the other person. They are neither painful nor make the eye itchy or red. Although vision can be restored in most people with cataracts, age-related cataracts are still the most common cause of blindness in the world, primarily because many third world nations lack appropriate surgical services. What are the different types of cataracts? Cataracts can be classified by anatomical location within the lens, degree of clouding of the lens, or by the cause of the cataract. The lens of the human eye is shaped similar to candy. It has a front anterior part and a back posterior part. The central portion of the lens is called the lens nucleus and the outer portion is called the lens capsule. Between the inner nucleus and the outer capsule is a portion of the lens called the cortex. Clouding of the lens can occur only in the nucleus, in which case the term nuclear cataract or nuclear sclerosis is used. If the clouding occurs in the lens cortex only, the cataract is termed a cortical cataract. If loss of clarity of the lens is primarily in the capsule, the term subcapsular cataract is used. The location of the clouding can also be defined as being anterior or posterior, central or peripheral. Often, the clouding of the lens may affect multiple portions of the lens. The most common type of cataract that is related to age is sometimes termed as senile cataract. This type of cataract primarily involves the nucleus of the lens. Cataracts that develop in the posterior subcapsular area in the rare region of the lens capsule are more common in a younger age group. Any degree of loss of the normal transparency of the lens is called a cataract. The more cloudy the lens, the more advanced the degree of cataract. A mild cataract may be mild, moderate or severe. It may be early or advanced. If the lens is totally opaque, it is termed a mature cataract. Any cataract that is not opaque is therefore termed an immature cataract. Most mature cataracts are white in color. What are the causes of cataracts? The lens is made of mostly water and protein. The protein is arranged in a specific way that keeps the lens clear and allows light to pass through it to focus a clear image onto the retinal surface. As we age, some of the protein may clump together and start to cloud a small area of the lens. This is our understanding of the cause of an age-related cataract. Over time, the cataract may become more dense or cloud more of the lens, making it more difficult to see through. A cataract is not a growth or tumor. There are many causes of non-age related cataracts or secondary cataracts. Secondary cataracts are a result of similar changes to the protein of the lens, also resulting in visual blurring or visual loss. Blunt or penetrating injury to the eye may cause secondary cataracts, either immediately after the injury or some weeks to years afterward. A cataract following an injury may appear and then not increase in a density, be stationary or be progressive. Eye surgery for other conditions can also cause cataract. Excessive exposure to ionizing radiations, X-ray, infrared radiations, as in glass blowers, or ultraviolet radiation cause secondary cataracts. Diabetes is associated with the development of secondary cataracts. Inflammatory disease of the eye, such as iritis or uveitis, may cause or accelerate the development of cataract in the involved eye. There are many genetic illnesses that are associated with the development of secondary cataracts. These include myotonic dystrophy, galactosemia, hypocystinuria, Wilson's disease, and Down syndrome, plus many other congenital infections with herpes simplex, rubella, toxoplasmosis, syphilis, and cytomegalic inclusion disease may also result in cataracts. There are many medications which, when taken over a long period of time, can cause secondary cataracts. The most common of these are oral corticosteroids, such as prednisone, which are used for a wide variety of medical conditions. The term congenital cataract is used when a baby is born with any clouding of the lens. This may be present in one or both eyes, be stationary or be progressive. Causes include genetic disorders or intrauterine developmental disorders, both often associated with other physical abnormalities of the baby. Atopic dermatitis, another disease of the skin and mucous membranes. Hyperthyroidism and hyperparathyroidism are associated with the early development of cataracts. Patients who develop cataracts in both eyes at an early age often have family members who have also developed cataracts prematurely, implying a genetic cause even in the absence of a recognized underlying disease. What is glaucoma? Glaucoma is a disease of the major nerve of vision, called the optic nerve. The optic nerve receives light generated nerve impulses from the retina and transmits these to the brain, where we recognize those electrical signals as vision. Glaucoma is characterized by a particular pattern of progressive damage to the optical nerve that generally begins with a subtle loss of sight vision, that is, the peripheral vision. If glaucoma is not diagnosed and treated, it can progress to loss of central vision and blindness. Glaucoma is usually, but not always, associated with elevated pressure in the eye, intraocular pressure. Generally, it is this elevated eye pressure that leads to damage of the eye. Optic nerve. In some causes, glaucoma may occur in the presence of normal eye pressure. This form of glaucoma is believed to be caused by poor regulation of blood flow to the optic nerve. How common is glaucoma? Worldwide, glaucoma is the leading cause of irreversible blindness. In fact, as many as 6 million individuals are blind in both eyes from this disease. In the United States alone, according to one estimate, over 3 million people have glaucoma. As many as half of the individuals with glaucoma, however, may not know that they have the disease. The reason they are unaware is the glaucoma initially caused no symptoms and the subsequent loss of sight vision, peripheral vision, is usually not recognized. What causes glaucoma? Elevated pressure in the eye is the main factor leading to glaucomatous damage to the eye. Optic nerve. The optic nerve, which is located in the back of the eye, is the main visual nerve for the eye. This nerve transmits the images we see back to the brain for interpretation. The eye is firm and round like a basketball. Its tone and shape are maintained by a pressure within the eye, the intraocular pressure, which normally ranges between 8 mm and 22 mm of mercury. When the pressure is too low, the eye becomes softer, while the elevated pressure causes the eye to become harder. The optic nerve is the most susceptible part of the eye to high pressure because the delicate fibers in this nerve are easily damaged. The front of the eye is filled with a clear fluid called the aqueous humor, which provides nourishment to the structures in the front of the eye. This fluid is produced constantly by the ciliary body, which surrounds the lens of the eye. The aqueous humor then flows through the pupil and leaves the eye through tiny channels called a trabecular meshwork. These channels are located at what is called the drainage angle of the eye. This angle is where the clear cornea, which covers the front of the eye, attaches to the base, root, or periphery of the iris, which is the colored part of the eye. The cornea covers the iris and the pupil, which are in front of the eyes. The pupil is the small, round, black appearing opening in the center of the iris. Light passes through the pupil, on through the lens, and to the retina at the back of the eye. Please see the figure, which is a diagram that shows the drainage angle of the eye. This diagram of the front part of the eye is in cross section to show the filtering or drainage angle. This angle is between the cornea and the iris, which join each other right where the drainage channels trabecular meshwork are located. The arrow shows the flow of the aqueous fluid from the ciliary body through the pupil and into the drainage channels. This figure is recreated from Understanding and Treating Glaucoma, a human anatomy board book by Tim Peters and Company Inc., Gladstone, NGS, New Jersey. In most people, the drainage angles are wide open, although in some individuals they can be narrow. For example, the usual angle is about 45 degrees, whereas a narrow angle is about 25 degrees or less. After exiting through the trabecular meshwork in the drainage angle, the aqueous fluid then drains into a tiny blood vessel capillaries into the main bloodstream. The aqueous humor should not be confused with tears, which are produced by a gland outside of the eyeball itself. This process of producing and removing the fluid from the eyes is similar to that of a sink with the faucet always turned on, producing and draining the water. If the sink's drain becomes clogged, the water may overflow. If the sink were a closed system, as is the eye, and unable to overflow, the pressure in the sink would rise. Likewise, if the eye's trabecular meshwork becomes clogged or blocked, the intraocular pressure may become elevated. Also, if the sink's faucet is on too high, the water may overflow. Again, if the system were a closed system, the pressure within the sink would increase. Likewise, if too much fluid is being produced within the eye, the intraocular pressure may become too high. In either event, since the eye is a closed system, if it cannot remove the increased fluid, the pressure builds up and optic nerve damage may result. Diabetic retinopathy is damage to the retina caused by complications of diabetes, which can eventually lead to blindness. It is an ocular manifestation of diabetes as a systemic disease, which affects up to 80% of all patients who have had diabetes for 10 years or more. Despite these intimidating statistics, research indicates that at least 90% of these new cases could be reduced if there was proper and vigilant treatment and monitoring of the eyes. The longer a person has diabetes, the higher his or her chances of developing diabetic retinopathy. Early disease may not cause symptoms. As the disease progresses, it enters its advanced or proliferative stage. Fragile, new blood vessels grow along the retina and in the clear, gel-like vitreous that fills the inside of the eye. Without timely treatment, these new blood vessels can bleed, cloud vision, and destroy the retina. Everyone with type 1 or type 2 diabetes is at risk for diabetic retinopathy. Diabetic retinopathy often has no early warning signs. Even macular edema, which may cause vision loss more rapidly, may not have any warning signs for some time. In general, however, a person with macular edema is likely to have blurred vision, making it hard to do things like read or drive. In some cases, the vision will get better or worse during the day. As new blood vessels form at the back of the eye as a part of proliferative diabetic retinopathy (PDR), they can bleed, vitreous hemorrhage, and blur vision. The first time this happens, it may not be very severe. In most cases, it will leave just a few specks of blood or spots floating in a person's visual field, though the spots often go away after a few hours. These spots are often followed within a few days or weeks by a much greater leakage of blood, which blurs vision. In extreme cases, a person will only be able to tell light from dark in that eye. It may take the blood anywhere from a few days to months or even years to clear from the inside of the eye, and in some cases, the blood will not clear. These types of large hemorrhages tend to happen more than once, often during sleep. Swelling in the portion of the retina that is most sensitive to light makes it hard for a patient to do things like read and drive. As new blood vessels form at the back of the eye, they can bleed and further blur vision. Large hemorrhages tend to happen more than once, often during sleep. There are no early warning signs. It is strongly recommended that all diabetics have eye examinations at least once, ideally twice a year. A refractive error or refraction error is an error in the focusing of light by the eye and a frequent reason for a reduced visual acuity. A refractive error is a very common eye disorder. It occurs when the eye cannot clearly focus the images from the outside world. The result of refractive errors is blurred vision, which is sometimes so severe that it causes visual impairment. The three most common refractive errors are myopia or nearsightedness, difficulty in seeing distant objects clearly. Myopia occurs when the cornea is too curved or when the eyeball is too long. This causes the light to focus in front of the retina, and as a result, the image formed on the back of the eye is not as sharp as it should be. 2. Hyperopia or farsightedness, difficulty in seeing close objects clearly. Hyperopia is usually caused by the eyeball being smaller than the normal. This means that the light cannot focus on the retina, it would focus it behind the back of the eye. When the eye is young enough and has strength to increase its focusing power, good near vision is possible but will generate eye strain. When this is not possible, near vision will become blurry. 3. Astigmatism, distorted vision resulting from an irregularly curved cornea, the clear covering of the eyeball. Astigmatism is the result of the irregular curvature of the cornea or of a more oval shaped eyeball. A fourth condition is presbyopia, which leads to difficulty in reading or seeing at arm's length. It differs from the other disorders in that it is likened to aging and occurs almost universally. Refractive errors cannot be prevented, but they can be diagnosed by an eye examination and treated with corrective glasses, contact lenses, or refractive surgery. WHO estimates that 153 million people worldwide live with the visual impairment due to uncorrected refractive errors. This figure does not include the people living with uncorrected presbyopia, which is likely to be quite significant. According to some early evidence, WHO, its member states, and partners are working to find ways to provide local, affordable corrective optical services to people in need, especially in poor areas with limited eye care services. When you think about it, the very act of actually seeing the world around us is an astonishing thing. It relies on the interaction between the brain and the eyeball, two extraordinary complex organs. So it's hardly surprising that there are so many ways in which we can suffer sight loss or reduction. The National Program for Control of Blindness (NPCB) was launched in 1976 as a 100% centrally sponsored scheme with the goal of reducing the prevalence of blindness from 1.4% to 0.3%. According to a survey in 2001-2002, the prevalence of blindness was estimated at 1.1%. The target for the 10th plan was to reduce this to 0.8% by 2007. A survey done in 2006-2007 estimated the prevalence of blindness at 1%. The main causes of blindness in India are as follows: cataract 62.60%, refractive error 19.70%, corneal blindness 0.90%, glaucoma 5.80%, surgical complications 1.20%, posterior capsular opacification 0.90%, posterior segment disorder 4.70%, and others 4.19%. The estimated national prevalence of childhood blindness, low vision is 0.80 per thousand. Thank you.